Hi, I'm Dr. Namratha Kandula, and we just finished up a fantastic session at AHA's Lifestyle Epi 2025 sessions on implementation science and health services research.
And I'm Dr. Bunmi Ogungbe from Johns Hopkins University. And it was such a wonderful session. I'm so glad that we got to co-moderate the session together.
Yeah, this is something that's been really important to the mission of the AHA is to take the incredible science that has been happening over the last 60 years about how to improve people's cardiovascular health, reduce the burden of cardiovascular disease, and really take what we've learned and move it into the real world. Because we know that one of the issues is that so much science never really makes it out to the communities and to the people who might benefit the most.
Right, absolutely. And just to really shorten that time, we don't have to wait decades for those really very important evidence-based strategies and interventions and programs to really start to make a difference in people's lives and ensure that people live longer and healthier lives and that their heart health is protected.
Yeah, and I thought the session did such a good job of Dr. Mate opening it up with a primer on implementation science and sort of setting the level playing field for all of us about like what is implementation science? What are some of the terms that we use? And then following that up with three excellent presentations that showed how we can apply implementation science in so many different phases of research and doing it in clinical settings, using digital technologies, and using a variety of methods.
Totally agree, 100%. If there's one session or something that I'm really taking away from this AHA Epi Lifestyle Conference, it's really that primer that she gave us, one of the many gems I'm going on with. It's very simple, just meeting everybody where they are. And I hope the audience feel the same as well, because we do have just different people in the audience. We had someone step up to the mic who I think is a senior in college, and obviously we had professors as well in the audience and other people in between as well. So it's really nice to see people really begin to appreciate implementation science and actually want to employ it in their research. And she just did a fantastic job of introducing the concepts to everybody.
Yeah, the first abstract was, so interesting to think about the fact that we have had statin medications for so many years, and statins can be really helpful both for primary and secondary prevention of heart disease and stroke. And despite that, in this particular study, they were looking at variation in a cardiology practice of how many patients are actually getting guideline directed statin therapies. And I thought this was a really good example of a study that's sort of pre-implementation where you're defining the problem and what is the scope of it and what are the characteristics of this practice and of the providers that are prescribing these statins and where are those gaps. And then as a next step, once we've identified those issues, what are we going to do about it? And so it really set the stage up nicely for a series of studies that might come after this to look at how we use different implementation strategies to improve the uptake of statins.
Right. And you know what can be done with those gaps? They eventually become implementation targets as this team hopefully develops that intervention or what may come after this. They could identify those specific gaps and say, this component of the intervention would target this, the other components of the intervention would ensure that the other implementation gap is addressed. I think it's a fantastic work, and I am really looking forward to the next steps.
Yeah, that's a really good point of the fact that I think implementation science is really well suited to kind of complex problems where it's not just, like you said, there's different gaps and different things we need to address to solve a problem collectively. And with this type of research, it's the ability to figure out how am I going to use a specific implementation strategy to address the fact that sometimes it might be inertia on the patient level, or it may be something on the health system level, or something in our community, and how do we address each of those? What did you think of the project with the home blood pressure monitoring and sending messages out to patients about their blood pressures and whether they're at goal or not?
I just was intrigued. I do some remote blood pressure work. You also do some remote blood pressure work. So it was really just fantastic to see a study that has gone beyond more than just transmission of the blood pressure readings from the home blood pressure monitors, but actually integrating this directly into the EHR and then responding to patients as their readings come through. I think it's fantastic work. I think it's very scalable as well, which is something we talk about a lot in implementation science. We want sustainability, we want scalability. We don't just want to do this in a single system. And most systems may be able to take some of the lessons from this pilot study that was presented and hopefully replicate it, especially once effectiveness has been established.
Yeah, and the investigator, Dr. Purcell, did talk about the idea that the next step is to establish more effectiveness. And despite that, I thought in this study they were already thinking about how are we designing this home blood pressure monitoring EHR interface so that it can be disseminated and scalable in the next step. And it's really nice to think about designing for dissemination very early in the stages of a project.
Yeah.
One example of that is when they talked about the fact that patients don't want too many messages coming at them all the time. And that is something that can be automated, which allows for scalability. But that's something to recognize before you're going to like roll out a program to a wider group of people, is what are the things that will allow it to work in the real world.
This is something we've really tried to implement, and we continue to work with health systems that we work with in some of the research that I do to implement this, and can be complex. The EHR is already an incredible platform and can be complex, and then trying to do some integration, there are a lot of bottlenecks. So it's really, really, really impressive to see the work that they've been able to do to at least get through that hurdle. And I do like in some of the results that were presented, there were things like patients wanting more personalized messages to be adaptive to them, to be adaptive to their unique situation, which I think it's really critical. And to your point about automation, perhaps these are one of the areas where we could use artificial intelligence to further move things along. I know that's a different topic that we could probably talk about all day.
Yes, yes. But speaking of other digital technologies and apps or web-based applications, the last project that was discussed today, the presentation, was on a topic that's very close to the heart of the AHA right now, as part of the Food as Medicine initiative, really looking at how this web-based application could help patients make healthier choices at the grocery store when they're purchasing food, and then combining that with like an easy to follow recipe to kind of overcome some of the cognitive and time barriers. They described some really nice qualitative work where the participants in the study were saying, like, just the thought of creating a healthy meal is so overwhelming. And what are some of the things that this web-based application, what was it called? Smart Cart?
Smart Cart.
Smart
Smart
Cart,
Cart
yeah.
2.0.
Yeah, what could Smart Cart 2.0 do to help people, when they're at the grocery store making these decisions about what foods am I going to purchase and how am I going to prepare them to be more healthy?
I just really love what was presented about this particular study. And I do like that it's developed by researchers and with patients and other stakeholders involved. And it just really helps to identify, well, the team had previously identified what some of the barriers were, and this web-based application is really defined and tailored to address those barriers. I would tell you, in my own personal life, I have gone to ChatGPT and say, look, I have lettuce and this and that. Could you please put together a recipe for me? And that's what this app does. So I would totally use it, for instance. It just takes out the cognitive burden and allow people, and I guess helps people and supports people to making healthier choices.
It was a very nice example of how qualitative methods can be used in implementation research to do more rapid cycle adaptation and translation. So it's not like we're going to develop this thing from scratch and do a whole big RCT to test it, but we already have some information about how this is working. Let's talk to individuals and co-create and adapt this app with them to specifically overcome some of these hurdles in preparation for a larger study. And so I think that was a really nice example of qualitative research methods, as well as the use of implementation research frameworks and models.
co-creation, which you just mentioned, I do want to uplift something that the American Heart Association integrated or embedded into the Foodist Medicine Initiative, the Healthcare by Food Initiative. It's the human-centered design and a co-creation with not just leaders in the community, but actual people, patients, and participants who would end up using some of these apps in this case, or the program or the initiative. So I think it's really really eye opening to see that in practice. And to your point, yes, qualitative data was really nice to see. I do like that in the presentation there were direct quotes from participants, and in some of the themes, a lot of it made sense. It just really could inform the next steps, which I think they plan to implement some pilots, and I think they're going to have a lot of this qualitative data inform that.
Yeah.
Yeah.
So overall, I think it was a fantastic session, a really good example of how implementation science is being used by members of our community to translate important science into the real world. And I'm really excited about all the opportunities through the American Heart Association to continue improving cardiovascular health.
Absolutely. Looking forward to more.